The views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Welcome to Public Health America, a 30-minute program on BronxNet where we talk with national experts to promote health and social justice. I'm your host, Dr. William Latimer. We begin by focusing on a current health topic from the COVID pandemic to cardiovascular disease. Our goal is to provide you with not only the best science, but practical tips to live a healthier life. On Public Health America, we also celebrate what studies have long documented, namely the unparalleled value of a college education by setting the stage to pursue a career of your choice, increase lifetime earnings and opportunity, and champion the ability to engage in civil debate. But for many, finding a path to college is neither clear nor certain. What if you're a high school student with supportive parents, but feel daunted by the prospect of being the first in your family to attend college? What if you're a single mother or father and want to attend college but have no childcare? On Public Health America, our expert will also talk about decisions they made and support they received that helped them beat the odds. By sharing one or two life lessons, their stories may provide you with the inspiration and method to realize your dreams. This is Public Health America. Welcome to Public Health America. I'm your host, Dr. William Latimer. It is my pleasure to welcome Dr. Glenn Morris, Professor and Director of the Emerging Pathogens Institute at the University of Florida, Gainesville. Glenn, welcome to the program.
It's a pleasure to be here.
Thanks so much. So we're going to talk about pandemics. I mean, obviously the last year and a half with COVID has just been terrible, awful, for the United States and the globe, but pandemics aren't new. Give us a thumbnail on the history of some key pandemics.
Well, again, I think, the word pandemic has suddenly gotten a lot of exposure in the last year. But what I do for a living is study pandemics. Pandemics have been around ever since there have been humans. You go back thousands of years. There was the plague of Athens, there was the Black Death. One of the pandemic diseases that I've spent a lot of time studying is cholera. And thousands of years ago, there were reports of cholera. And since that time, it's continued to be present. Last year, there were over 1 million cases in the world. If you come back to the picture that was just on, currently cholera is distributed globally. A lot of the cases are present in Africa, and then they spread everywhere. And again, I think that's one of the things to emphasize about pandemics. There we go. What you can see is the colored spots, the darker colors are where the most cases are. Actually, right now, we're having huge problems in Yemen. But what I want to emphasize is that when you talk about pandemics, infectious agents don't show any borders. They go everywhere. And you get global spread of disease. Now, recently, that's gotten a whole lot of attention because of COVID. And so while we've spent a lot of time studying other pandemic diseases, recently we've done a lot of work with COVID.
So let's turn our attention to COVID. I know you've done some important work on aerosols and how COVID is transmitted. Tell us a little bit about that.
Well, I think one of the concerns when COVID first showed up was, again, how's it being transmitted? And there were the statements you needed to stay 6 feet away from people. You needed to wear a mask. And both of those are very important because the organism can be transmitted basically when you talk or speak. But I think one of the things that we have spent a lot of time looking at is aerosol transmission. In other words, you have various sized particles that come out of your mouth and out of your lungs that can carry the virus. And you can have very, very, very small particles which drift through the air and can travel extensive distances. And actually, if you can show the last slide in the slide set, again, what you see up at the top is if you've got big particles, they tend to drop out fairly quickly. They can stay a little bit longer, and then they can sometimes drift and go extended distances. Actually, the bottom slide shows the study that we did in the hospital, where we sample the air inside the room of a patient. And we found that we were able to culture the virus from the air 20 feet or more away from the patient. This was a patient who wasn't coughing, who was simply laying there in bed, breathing. And nonetheless, we were able to see the organism travel for extended periods, for a fair distance. And so this gets back to the importance of trying to stay away from environments where the virus can congregate. So if you've got a small room, poor ventilation, like inside a bar, lots of people talking and laughing and singing, which tends to promote excretion of the virus, then there clearly is an increased risk that one can see transmission of the virus. And people inside that room clearly can be at increased risk of infection. So again, a lot of what we worked on is trying to understand the subtleties of what happens and what are the critical risk factors for transmission of pandemic agents, such as, in this case, the virus that causes COVID.
Very helpful. So let's change gears a little bit and talk a little bit about what I think is still on a lot of people's minds, and that is vaccine safety. I mean, I think there's been, obviously a fair amount of press about variability by state in terms of vaccine uptake. I know here in New York, a lot of the restrictions have been lifted, almost all of them, quite frankly. And I think that has coincided with a level that's at least one vaccine shot for 70% of the population or greater. Talk to us a little bit about vaccine safety. Talk to us a little bit about herd immunity and how that informs what people should do.
Well, again, when you come back to thinking about the ways this virus is transmitted, it is very easy for it to be transmitted. And so while masks help, they're not perfect. What we really need is to sort of pump up our own immune system so that we are able to handle the infection on our own. And vaccines do that. And we've actually been incredibly fortunate in that there have been several excellent vaccines that have been developed, particularly mRNA vaccines. And those provide good protection against any illness, or in particular serious illness that's caused by COVID. The problem is that we are starting to get changes and evolution in the virus strains as the disease progresses. The appearance of the different variants, alpha, beta, gamma, delta, it starts getting really confusing. So far, the bottom line is that the vaccines that we have are good enough that they work. And so again, coming back to the idea of aerosols, sometimes it's hard to prevent transmission. This is an easily transmitted virus. It can drift through the air. It can cause transmission at a distance. But under those circumstances, your best protection is a vaccine. The vaccines are safe, and clearly they should be at the forefront of our effort to try to limit transmission of this disease.
For a lay audience, Glenn, mRNA vaccine, what is it and how does it differ from other vaccines? Why is it better?
Well, it's kind of interesting. It's a new approach to making vaccines that actually has the body generate some of the what we call antigen or the viral particles, not the whole virus, just little tiny critical pieces of the virus that stimulate your body immune system. I'll have to say, I didn't think they were going to work. So did a lot of other people, but they have worked. They've turned out to be extremely effective, very safe. They don't do the things that you hear on social media. They do not cause sterility. We and others have carefully looked at that. They don't cause a lot of the other serious potential side effects that you hear about, although there are occasional side effects. Nonetheless, overall, they are safe and effective vaccines and work extremely well in protecting you from acquiring this viral disease.
Herd immunity. What does it mean? What's the right number? Does it vary by geography or population? And why does it matter?
Well, essentially, the idea behind herd immunity is that if there are enough people that are immune to a disease, then the virus or the bacteria is going to have difficulty finding enough people to infect to be able to actually spread rapidly. This is getting a little technical, but essentially, the number of people it takes to really be able to have a population which overall is protected against the virus is dependent in part on the transmissibility of the virus. If the virus is very, very easily transmitted, then you're going to have a high percentage of the population that is immune. For measles, we probably have to have anywhere from 90 to 95% of the population immune to be able to block transmission of measles. We had initially thought that if we could get 70%, somewhere in that range, we might be able to block transmission of coronavirus. What's making this tricky is that some of the variants are much more transmissible. And so consequently, you've got to have a larger population of immune people to really be able to get a herd immunity effect. So particularly with the Delta variant, that's easily transmitted, much more easily than the original coronaviruses. And so consequently, we may need to edge on up into the 80%, 85% to really be able to start seeing significant protection. So I think herd immunity is still something we're not quite sure what it's going to take. However, clearly right at the moment, we are seeing that with the widespread vaccination we've got in the United States, we clearly are seeing decreases in the numbers of cases.
Sure, which is great news. We just have a moment or two left, Glenn. Let me ask you one last question. So, years ago when I was a much more foolish young man, I never got the flu vaccine. And of course, every winter I got the flu, and then I kind of figured it out. And now for years I've taken the flu vaccine. And since then I haven't gotten the flu, knock wood. With the COVID vaccine, is that an annual thing?
I think a lot's going to depend on things like the appearance of variants, particularly ones that are more easily transmissible. I would say that there is at least a reasonable chance that particularly for people who are older or who have risk factors, that you're going to need an annual booster, just like you need an annual flu booster. Now, it's possible that for younger people at lower risk, you may be able to go 2 years or 3 years, or maybe even longer. We're going to have to sort of work this out as we go along, and a lot's going to depend on how the virus itself evolves. Again, when we talk about pandemics, a key element is how the virus or the bacteria evolves so that as it moves through populations. And unfortunately, what we're seeing is evolution of variants that are more easily transmittable and are better able to cause disease. And so that may increase the need for an annual booster.
Got it. We're going to take a quick break. We're here with Dr. Glenn Morris from the University of Florida, director of the Emerging Pathogens Institute, giving us some great information and updates on COVID and pandemics generally. We'll be back in a moment where Dr. Morris will talk a little bit about his personal history and how college made a difference. Welcome to Public Health America. I'm Dr. William Latimer. Welcome back to Public Health America. I'm your host, Dr. William Latimer. I am here with my guest, Dr. Glenn Morris, professor and director of the Emerging Pathogens Institute at the University of Florida, Gainesville. He's been chatting with us about COVID and pandemics generally. Glenn, it's so great to have you on the program. Let me ask you the question I ask at the beginning of this segment. Tell us a little bit about your formative experiences, where you were born, and so on.
Happy to do so. And again, I think a lot of this for me ties into what I've ended up spending my life doing. I had a little different background coming in. My parents were missionaries, and consequently, I grew up overseas in Bangkok, Thailand. Now, you remember I talked back at the beginning about cholera, this disease, cholera. Cholera is a really nasty disease. It can kill you within 4 to 8 hours. And if you aren't properly treated, you can get mortality rates of about 40%. Bad stuff. And it comes in waves. There have been 7 pandemics of cholera since the early 1800s. Back to this idea that pandemics are nothing new. We just haven't paid quite as much attention to them as we have with COVID. And so consequently, when I was growing up in Bangkok, the 7th pandemic of cholera started over in the Philippines and spread rapidly through all of Southeast Asia. And I remember living in the city of Bangkok when the cholera epidemic hit, and it was devastating. Now, all of us now have experienced what pandemics are like with COVID. But for me, the critical experience was being a young kid and being in a setting where people were dying all around. There would be somebody you knew today, and tomorrow they would be dead. And there was treatment, but there was not a good vaccine. And so it was sort of like where we were at the beginning of COVID. Not a good vaccine, people were dying. Try to prevent it? Yeah, but we're not quite sure how. And so, growing up, I was really impressed. And again, what happened was that every year we had the pandemic, the cholera pandemic come through. It wasn't just one time. And slowly good vaccines were developed, and we developed a good understanding of appropriate therapy. But all of that took time. And as a kid growing up, there was within me the sense of, we need to do something about this. This is important stuff. And I think perhaps more so than a kid growing up in the States, where there may not have been the pandemic impact, at least at that time, for me, growing up in Thailand was extremely important.
Sure. What an extraordinary story. And obviously, how could that not be immensely formative in so many ways? So it almost leaves me at a loss because I could think of so many directions to go. What was, when you were a child in Thailand, where did you go to school, and at what point did you, I assume at some point you moved back to the States. At what point did that happen?
Yeah, I actually there I went to a school that was called the International School Bangkok, which basically was for kids who were of missionary or diplomatic parents. And I came back to the States for college. And I think as with everybody who's going to college, the question is, what do I really want to study? What's this all about? What direction should I go? What do I want to do with my life? And, I think as with all college students, I explored a lot of different things. Sort of a standing joke that when you're in the first or second year of college, you change your major at least 3 or 4 or 5 times because you discover new things and new ideas. And for me, college was an incredibly exciting time because I found myself, coming to grips with new ideas and new approaches. And what I discovered was that where my real interest laid was in 2 areas. First of all was biology. Beginning to really understand how these biologic systems work and might play into things like rapid spread of disease such as cholera. And interestingly, the other thing I got really fascinated in was Chinese history. It's sort of, where did that come from? Well, I grew up in the Orient, and it really became fascinating to look back through Chinese history. But as I did, I discovered I also tended to end up looking at the descriptions of the epidemics. I mean, there was a goddess of cholera in India and Bangladesh because the disease was so prevalent.
Right.
It was such an incredible part of life. And so the two started to come together, and I really began to think that what I really wanted to do was spend my life trying to understand how pandemic diseases arose, where they came from, and how they are best prevented.
Sure. That's great. During your undergraduate experience, what were some of the elements that sort of helped you to succeed? Was there a key mentor, a great teacher, some experiential learning? I mean, there's no right answer here. I'm just wondering, is there something that stands out in your mind during your undergrad experience that really helped you to succeed?
Well, I was fortunate I was at a small university, and we had some really, really outstanding teachers. It's hard to put my finger on one or two people who were, particularly outstanding. I think the main thing to emphasize is that in the college environment, there are a lot of very smart people, and there's a lot of interesting ideas floating around. And it provides a unique opportunity to think about things, begin to put pieces together, and figure out what really matters in your life and where you're going. And for me, the decision actually, it didn't come until I was in my senior year of college, was that, I really want to go to medical school. But then the other part of it was, but I really want to do infectious disease and tropical medicine. And so I got lucky, and I was able to go to Tulane School of Medicine, and at the same time also get a degree in tropical medicine simultaneously. And this sort of, for me, put all the pieces together. It gave me the understanding of how one deals with sick people, but it also did so in understanding the diseases in the tropics and set up things so that I could move into a long-term career in terms of research. And the other thing I would mention, and I know the focus is on college, but as you get through college, you're also looking at what's on the other side. When I graduated from medical school and had my degree there, I was fortunate enough to be able to go to the Centers for Disease Control, to CDC, and work as an epidemic intelligence service officer. CDC appoints about 50 such officers each year. It's a 2-year training program. And essentially what you do, you're the frontline people in investigating epidemics. And so I spent 2 years going everywhere in the world that CDC sent me, following up on epidemics and trying to understand what caused them. And so again, it was a really exciting time, probably the most exciting 2 years of my life, because essentially on 2 hours notice, I had to be able to and ready to go anywhere in the world where there was an epidemic that needed to be investigated. And so again, it all sort of came together in the training at CDC and subsequently in my career as an infectious disease specialist, as a physician, but also as somebody who, I hate to say loves epidemics, but who really, understands epidemics and really gets excited when placed in a position to explore and better understand how and why epidemics occur.
Sure, that's great. Glenn, let me ask you this. The CDC stint, was that before or after Tulane?
That was after Tulane.
Got it.
That was after I got my doctoral degree. So again, it's a long path, but the other side of it is you can do it. And it's something that getting through college sort of set me on the way. Medical school, it's a long slog, but for me, doing that and getting the tropical medicine degree, and then on the other side, ending up spending time at CDC, where I truly was on the front line of epidemics everywhere in the world.
Sure. No. I mean, clearly, I think some threads of your story that I think are so important, and some of them are incredibly unique, and I think some of them are normative in a very positive way, meaning in your undergraduate experience, isn't it fair to say that you kind of had a very open-ended journey that culminated in your figuring out what you really wanted to do, but that didn't happen until your senior year. And my main point there is that's great. There's nothing wrong with that. That's what undergrad can be, is an exploration. And then you, whether we call it serendipity or not, but then you found an institution in Tulane. And by the way, I was chatting with my dear friend, Dr. Tom Levis, just a few days ago, who's at Tulane now, that allowed you to sort of merge the elements of the training that you needed to really create a career path for yourself that has been, unbelievably successful. In the last minute we've got, if you were talking to a high school student today in an urban area, based on your incredibly rich lived experience, what would you say to them in terms of, what's going to help them get into succeed in college?
I think the biggest thing is to come at it with a sense of excitement. College is a unique opportunity to explore, to really get exposure to a lot of new ideas, to really discover who you are and what you want to do. And so for me, that clearly was what college was. But I think the other side of it is coming at it with an open mind and a sense of excitement and a willingness to reach out and try to understand who you are. And for me, college was the time when I really came to understand who I was and how I could begin to put all this together into what has turned out to be a very exciting career.
I want to thank Dr. Glenn Morris of the Emerging Pathogens Institute of the University of Florida for sharing his story and talking to us about pandemics. I want to thank our viewers for tuning in. I'm your host, Dr. William Latimer. This is Public Health America.